Muscles become sore from overuse, overexertion, tension, trauma, work demands, stress, and poor posture. When a muscle injury occurs, there is often a shortening of the muscle fibers to protect itself from further injury, resulting in a loss of range of motion of the joint. In addition, the muscle and associated structures can develop localized tender points. Pain associated with this type of injury is referred to as aching, extensive and capable of being experienced in a distant part of the body. If not treated effectively, the result can be the vicious cycle of increasing pain, muscle spasm, and loss of function. Traditionally, self-treatment for this type of pain has taken the form of mild medication, heat, and rest. Deep pressure massage of tender areas and sore muscles has not been utilized because there was no effective way for the patient to do this themselves at home. Now there is a device which is easy to use and very effective in easing the pain of these tender areas, the Thera from ProMassage. The Thera has been used successfully to enhance relief from muscular pain by applying pressure directly to hyperirritable tender points on any part of the body. In addition, the Thera can be used regularly on all the muscles of the body to help stretch and loosen both muscle and soft tissue. Deep pressure massage has a wide variety of benefits and tangible results. On the physical level, it can produce deep relaxation and stress reduction, relieve muscle tension and stiffness, reduce muscle spasm and tension, and increase circulation. On the mental level, massage promotes a relaxed state of alertness and reduced mental stress. On the emotional level, the feeling of well-being and self-image is enhanced. Each ball on the Thera is numbered 1 through 6. These numbers will be referred to throughout the program. Before showing you how to effectively massage different areas of the body, there are a few basic principles you should remember. 1. Apply direct pressure for 5 to 10 seconds, release, and repeat as desired. 2. While applying moderate pressure, slowly move the ball back and forth across the muscle. 3. Use a combination of the above techniques that work best for you. Experiment on your own. Take your time when you massage with the Thera. Do a little today and more on each following day. Since some muscles may have been injured or neglected for some time, it may take a few sessions to achieve the long-lasting therapeutic effects you are seeking. Be patient with your progress. Position the Thera in ways which allow the Thera to work for you. Take advantage of the superior mechanical abilities this body tool provides. It is always a good idea to stretch the muscles before your massage session to help locate tender points, and after your session to help reduce muscle tension and make the body feel more relaxed. Because of the unique design of the Thera, the tool, rather than the user, should do the work of relieving those hard-to-reach tender points. A minimal amount of arm movement is all that is usually needed for effective treatment. Take your time when you probe for tender points, moving the ball over the muscle at 1-inch intervals. When you find a tender point, concentrate your attention on that one spot. You will get better results. Never use the Thera to attempt to treat medical ailments or injuries. Always consult with your medical practitioner for treatment of any medical condition and before initiating any therapeutic massage or exercise program. Refer to the Thera brochure and review the precautions section prior to use.
Hi, I'm Bob Anderson, author of the book Stretching. Last year I met Dan Hennessy, the creator of the Thera. Since then I've been using the Thera every day to relieve the muscle tension and stress in the upper body. I think this is a sensational body tool and I highly recommend it to everyone that I meet. Now without further ado, I would like to introduce you to Dan Hennessy, the creator of the Thera. Dan, good job.
Thanks, Bob. As you know, I developed the Thera for my own use, to relieve chronic pain I was having as a result of neck surgery and a herniated disc in my back. My condition had a number of different names attached to it: fibromyalgia, fibrositis, and myofascial pain syndrome, to name a few. The bottom line was that I hurt most of the time. The Thera worked so well for me in relieving my pain and in improving the quality of my life that I knew others would have a need for it also. Today, thousands of people, athletes like yourself, Bob, and others like myself, are benefiting from using the Thera.
Dan, I think this video is going to really benefit people in the real uses of the Thera.
Exactly, Bob. It will make the Thera more useful, beneficial, and fun to use.
Well, I think I'll stay around for a while. Maybe I'll find some new uses for the Thera.
That's great, Bob. Those of you watching, grab your cane and follow along.
To begin, Dan will pretend he has never seen the Thera before. Perhaps your initial reaction was similar. Okay, Dan, loop it around your neck and grab hold of it. No, not that way. Switch your hands around. Now move your right hand down to the end of the cane. Isn't that more comfortable? Okay, Dan, you're on your own. To begin, standing, using the number 1 ball for the upper back. Push out with the lower hand to apply pressure while keeping the upper arm still. Be sure to change hand positions when massaging the opposite side of the body. To massage with a Thera, apply direct pressure to the muscle. Press and hold for 5 to 10 seconds. Release and repeat as desired. A second method is to slowly move the ball across the muscle while applying moderate pressure. Next, standing, using the number 1 ball for the upper back. Notice the hands are positioned the same as in the preceding method. To apply pressure on the back muscles, slowly thrust the right hand forward. Now Dan is showing some incorrect ways to use the Thera. Proper use requires a minimal amount of hand and arm movement. It is important to keep the ball in contact with the body to decrease the likelihood of skipping over any tender points. For most effective treatment, pay equal attention to both sides of the body. Next, standing, using the number 6 ball for the upper back. Note that the left hand is holding the cane near the number 1 ball and the right hand is reaching behind to grasp the cane at the end, next to the number 4 ball. Push the upper arm forward to apply pressure on the back muscles. Lean forward slightly to increase the pressure. To massage across the tender point, move both hands slowly up and down. Next, lying down, using the number 1 ball for the mid-back. Slip the number 1 ball underneath the back. Push the right hand forward to exert more pressure on the back muscles. You may use 2 methods. First, find a tender point. Then press and hold for 5 to 10 seconds. Next, move both arms very slowly back and forth while maintaining pressure on the back muscles. This is a good method to use to search for tender points. Try both methods to see which one works best for you. Next, sitting, using the number 1 ball for the mid-back. Slip the hook portion of the Thera under your arm and behind your back. Lean back and relax. Push your right arm forward to exert more pressure on the back muscles. Once you've found a level of pressure you're comfortable with, move your upper torso side to side, allowing the muscle to move across the ball. Try this position while relaxing in an easy chair. Next, standing, using the number 6 ball for the mid-back. Note how the left hand is holding the cane at the number 1 ball, the right arm is looped inside the number 3 ball at the elbow. Push your right hand forward to exert more pressure on the back muscles. Move your right arm back and forth to massage across the muscle. As always, massage the opposite side of the body for best results. Next, standing, using the number 1 ball for the low back. Hold your left hand on the hook near the number 1 ball. Push up with your left hand so the number 1 ball is pressing into the low back muscles. Move your hand slowly back and forth. Arch the back slightly for this movement. Next, sitting, using the number 1 ball for the low back. Sit in a chair at an angle, with the side you will be working on closest to the back of the chair. It is best you use a chair with a firm back. Position the cane against the back of the chair and stabilize it. Lean into the ball and slowly rock from side to side. Note the left hand is remaining stationary, which helps stabilize the cane for you. Next, standing, using the number 6 ball for the low back. Note that the right arm is positioned on the outside of the number 3 ball, while the left hand is holding the cane near the number 1 ball. For best results, keep the hand holding the hook portion of the cane still, resting along the thigh. To apply pressure, push the right arm forward from the elbow. To massage across the muscle, move the right arm back and forth. As always, massage the opposite side of the body for best results. Next, sitting, using the number 5 ball for the neck. Position the ball on the area of the neck you want to massage. By pressing down with the left hand on the number 1 ball, you determine the amount of pressure applied to the neck. Keep the ball in contact with the skin as you slowly move the ball across the muscle. Next, sitting, using the number 1 ball for the neck. Using this method, the forward thrust of the right hand determines the amount of pressure on the neck. Tender points are normally surrounded by taut muscle fibers, and they characteristically refer pain to other parts of the body. For example, neck pain is sometimes referred by tender points in the shoulder muscles. Next, sitting, using the number 3 ball for the neck. The downward thrust of the right hand on the number 2 ball determines the amount of pressure on the neck. A variation of this method would be to rest the hook portion of the cane on the thigh. In this manner, pressure is controlled by leaning the neck into the ball. This position is also an effective method to massage the jaw muscles. Next, sitting and lying down, using the number 5 ball for the neck. The muscles at the base of the skull often are tight and may contain tender points. Note the positioning of the Thera cane for easy access to these muscles. An effective technique for the neck muscles is to press and hold for 5 to 10 seconds, release, and repeat as desired. These muscles can also be massaged effectively while lying down. Slowly move your head over the number 5 ball. It's fun to experiment with the Thera cane to find the easiest to use methods which are most beneficial for you. Next, standing, using the number 1 ball for the shoulders. With this method, the left hand is positioned at the top of the hook. This provides excellent control, especially for those just learning to use the Thera cane for deep pressure shoulder massage. Resting the forearm on top of number 2 is another method for shoulder massage. Move your arm slowly back and forth to apply pressure across the muscle fibers. Try both methods and experience for yourself the amazing versatility of the Thera cane. Next, sitting, using the number 1 ball for the shoulders. The positioning of your hands for this method is a simple variation of the preceding position. One arm rests on top of the number 2 ball, while the opposite hand rests on top of the hook. Positioning your hands in this manner provides effortless deep pressure massage. Gradually allow the ball to massage over the muscle while gently probing for tender points. Examine the muscle at 1-inch intervals. The Thera cane can be positioned across your body or off to the side, leaning against the back of a chair. Next, sitting, using the number 5 ball for the shoulders. This is the incorrect way to use the Thera cane. The correct method to massage the left shoulder is to have the right hand on top of the cane. This keeps the muscles of the shoulder you are working on relaxed. Remember to let the Thera cane do your body work for you. Take advantage of the superior mechanical abilities the Thera cane provides. As always, work both sides of your body for best results. Press your upper hand down towards the shoulders to probe in and move your hand slowly back and forth to work the ball across the muscle. Next, sitting, using the number 4 ball for the chest. Position the Thera cane on a table, couch, or the floor, and lean into the number 4 ball for deep pressure massage of the chest muscles. Note the hand placement for easy use. As always, work both sides of the body for best results. Next, standing, using the number 2 ball for the chest. Note the proper hand placement for this method. Push your left hand in towards your chest to apply pressure. Move your arm slowly back and forth to probe the muscle for tender points. Next, standing, using the number 1 ball for the rib cage. Loop the left arm around the hook portion of the Thera cane. Place the ball on the muscle and slowly rotate your arm and upper torso to apply deep pressure massage to this area. Next, sitting, using the number 2 ball for the hips. To massage the hip area, position the hook portion of the Thera cane into the crease of your elbow. The weight of the arm provides the leverage needed for deep pressure massage. Move the cane slowly across the muscle as you search for any tender points. Next, sitting, using the number 4 ball for the groin. In this position, both hands are placed at the top of the hook. A slight rocking motion of the upper torso helps to move the muscle over the ball. A variation of this method is to place the number 2 ball under the arm. In this position, the effort needed for deep pressure massage is provided by leaning into the muscle from the shoulder. Next, sitting, using the number 3 ball for the arms. Loop the hook portion of the Thera cane under your leg so that the number 2 ball rests on top of your leg. Place the back of your arm on the number 3 ball. This method may be used to massage the muscles from the back of the upper arm to the elbow. Next, sitting, using the number 6 ball for the forearms. Hold the cane in close to your body to maximize the leverage capabilities of the Thera cane. Additional pressure may be applied on the forearms by pressing inward on the muscle with your opposite arm. Once a comfortable level of pressure has been reached, move the forearm up and into the ball for easy massage. Next, sitting, using the number 6 ball for the forearms. Rest your forearm on top of the number 6 ball. For additional pressure and added control, place the opposite hand on top of the one being massaged. This method also works very well for the wrist and hand muscles. Next, sitting, using the number 2 ball for the upper arms. Push into the muscle with your left hand for pressure and push out with your right hand to obtain the proper leverage for this method. To avoid having the ball slip off the muscle, let the ball sink into the muscle slightly before attempting to move it across the muscle. Next, sitting, using the number 5 ball for the upper arm. Sit sideways in a chair that has a firm back. Position the Thera cane on top of your lap while leaning against the back of your chair. Lean into the number 5 ball for superior deep pressure massage. Move your upper body slowly back and forth across the muscle. The Thera cane is stabilized by the back of the chair and the position of your hands on the hook portion of the cane. This is the incorrect way to use the Thera cane. The correct way is to keep the hand holding the hook portion of the cane still. This helps utilize the leverage capabilities of the cane. Sweep the opposite arm back and forth to assist in locating tender points. Push the thighs outward for added pressure. To massage the opposite leg, switch the positioning of the cane. Again, if you find a tender point, concentrate your efforts on that one area. Next, sitting, using the number 6 ball for the upper legs. Position the Thera cane across your lap and loop the hook portion of the cane under your leg, opposite the one to be massaged. Slowly sweep the ball back and forth across the muscle while applying a slight downward pressure. If you find a tender point on the muscle, concentrate on that one area. Next, sitting, using the number 6 ball for the lower legs. Position the Thera cane so it is looped around your leg, opposite the one to be massaged. Slowly sweep and probe the leg muscles for tender points. A slight movement of the leg will assist you in working the ball across the muscle. Next, standing and sitting, using the number 6 ball for the upper legs. Loop the Thera cane around the legs in a manner similar to the preceding methods. Slowly sweep the number 6 ball over the muscle to assist in locating any tender points. If you detect any tenderness, try sitting in a chair and resting your leg directly on the number 6 ball. This method requires less effort on your part. Slowly move your leg back and forth across the ball. Be systematic in your approach and patient with your progress. Next, sitting, using the number 5 or the number 6 ball for the lower legs. Loop the Thera cane around your leg opposite the one to be massaged. Slowly sweep the muscle to assist in locating any tender points. For extra deep massage, sit on a table or the floor and rest your lower leg on top of the ball. You will notice it's possible to use either the number 5 or the number 6 ball for this method. Support yourself by leaning back with your free arm. Next, sitting, using the number 4 ball for the legs. Hold the Thera cane so that the number 2 ball is positioned under your arm. To apply pressure to the upper and lower legs, place the ball on the muscle and lean into it slowly from the shoulder. This is a good method to use for the inside area of the legs. Next, sitting, using the number 3 and the number 6 ball for the feet. Loop the hook portion of the Thera cane around your leg, opposite the one to be massaged. This helps to stabilize the cane so there is no unnecessary work required of you. Slowly press and sweep the ball across the muscle to search for tender points. Next, sitting, using the number 2 ball for the feet. We are using the number 2 ball, but virtually any ball can be used for this method. Find a tender spot and rest your foot on the ball. To increase the pressure, place your opposite foot on top of the one you are massaging.
There you have it. From head to toe, a safe, simple, and effective method to massage the muscles of your body. Now let's review some of the basic principles. Once you have located an area which exhibits tenderness, take your time when you massage. Do a little today and more on each following day, up to several minutes per tender area. If an area is very tender, apply light pressure the first day. You do not want to overstimulate and possibly inflame the area. In a few days, apply slightly more pressure. You need to judge the amount of pressure to apply since you know your body best. Let the Thera cane work for you. Use the leverage designed into the Thera cane to achieve the most efficient and effective results. Remember, it is important to perform stretching exercises both before and after your massage session. A program of regular stretching can help you in many ways. For instance, stretching will help to increase your range of motion, help to relieve muscular tension and stress, help you to tune into your body and its needs. Stretching will help to make you feel better. Heat such as warm packs or hot showers are also recommended before and after your deep pressure massage session to help relax tight muscles. Remember, you do not have to have tender points to realize the benefits of the Thera cane. You can use it as a total body massage tool to help relieve tension and tightness in the muscles.
The Thera cane feels great on all your body's muscles, and it helps you to get in touch with your body's needs. Now enjoy your massage session and good health.